So what is Botox? Botox is a botulinum toxin type A. And then from there are 5 different brands that are FDA approved here in the US. They can be that they don't have preservatives. For example, Xeomin doesn't have the same preservatives. It can be that are stronger and then they have a different mechanism of action and they can last a little bit longer on your face. So from all these 5, we have Botox, Xeomin, we have Jeuveau, we have Dysport, and we have Daxi now. So for this type of videos, today we're gonna talk about Xeomin specific. Xeomin cause headaches? No. It's more because the needle prick that goes into the muscle that can cause a little bit of headache. And that can happen with any other Botox product, not just Xeomin. Botox in general can cause a little bit of headache after the treatment, but it's more because of the needle prick. So just because the needle went into the muscle, they can create like a little bit of headache in your face, but it's actually an FDA approved treatment for headaches, especially migraine headaches. In general, why is that the headache happens is because the muscle got pricked. So that needle stimulates the muscle, but there is like a tension happening in the muscle. And that's what we think it's a headache, more because it's sore in that area. So imagine, for example, when you get your blood work done or you get like a prick in your belly, it's sore. And yes, you can have an arm ache, but we don't have a specific word for the arm, like we say headache or like stomach ache. So that's why we say, oh, I have a headache. And it's not a headache in terms of a migraine headache, it's more because of the prick directly to the muscle that creates that tension and creates almost the same as when we call tension headache. Some patients can experience a little bit of headache after a Xeomin treatment, but it's not because of Xeomin or because of the Botox. It's more because the needle prick directly to the muscle create this pressure, almost like a pressure headache. But Botox or Xeomin is FDA approved to treat headaches, especially migraine headaches. So if you have a headache or you experience a headache after a Botox treatment, you can take Tylenol. Tylenol is a pain medication that it's approved for after Botox treatment, and it's not gonna cause any extra bruising. So the best pain medication for headache after a Botox treatment or like a Xeomin treatment is gonna be Tylenol. If you experience a headache after a Xeomin treatment or any Botox treatment, you can just put cold compresses in your forehead. You don't need to treat it with medication because it's gonna go away. It's gonna go away in a few hours. It's not because of the Botox treatment, it's more from the prick. If you worry about headaches after your Xeomin treatment, you can do is either take a Tylenol before the treatment, or another good thing is to drink lots of water. The more hydrated you are, the less probability you're gonna have a headache. Sometimes headaches are related to dehydration. And it might be that because you're dehydrated, your veins or your blood vessels are trying to maintain that volume in your body. And when you get the Xeomin treatment or you get the Botox treatment, it's gonna cause a headache. So by hydrating before your Botox treatment, your blood volume in your system is gonna be normal and it's not gonna cause that headache or that tension headache. I have patients that had the headaches after and patients that treat the headache actually after Xeomin treatment. So what do we do for those patients that had the headaches? I like to always tell them to hydrate before, to take Tylenol before the treatment, and then hydrate after. And it usually lasts for a few hours and it's not gonna last. This headache is not gonna last. For patients actually that tend to have migraines, how they discover the treatment of Botox for aesthetic treatment is because it was meant to be a medical treatment for migraines. And when the patients start having migraines, usually how migraine headaches start, it starts in one area. It's always localized. For patients that had their localized headache in their forehead, they will treat the Botox, they will put the Xeomin in their forehead, and they realize that the migraine was gone and the headache was gone, but at the same time the wrinkles were gone. So that's how they discover Xeomin treatment and Botox treatment as an aesthetic treatment, because after they treat migraines, the wrinkles were gone. So another thing, as I mentioned, Botox and Xeomin is FDA approved for migraine headaches. So if you have migraine headaches, this can be approved as a medical treatment. So talk to your doctor, talk to your primary care provider, and see if this can be approved by your insurance. Your insurance can cover it because it is a medical treatment. Another thing that Xeomin is approved, which is good, it's not just aesthetic treatment, so it can treat migraines in all over the body. Sometimes people can start that trigger point in their neck, it can go in their heads. This Xeomin is FDA approved to treat all this pain or muscle pain, and we can treat different areas, just the back of the head, the neck, not just the face as an aesthetic treatment. Xeomin is one of the 5 brands that is FDA approved here in the US, and the most common one is Botox, because it's Botox the brand that contains the Botox. But all of the Botox treatments are including the same botulinum toxin type A, and at the same time it's just that they have different names, and most of the time is they're FDA approved for the same period except Daxi. Xeomin is FDA approved for 3 months, and depends on the areas where we're treating. Sometimes it can last a little bit longer, it can last a little bit shorter. Another study that it's done on Xeomin is that if you add more units, it can last actually longer. So if, for example, it was FDA approved for 20 units in the glabella, we can add up to 60 units and it is gonna last a little bit longer. However, here it becomes more on the look that we're trying to get. Here at SYA, we always go for the natural look, and it always depends on the strength of the muscle and how we're gonna emphasize your face. There are other Botox approved, like Daxi, that it's supposed to last the longest. So Daxi is the FDA approved for 6 months. Some patients complain or mention that Botox doesn't last enough. And that can be not only with Xeomin, it actually can be with different type of Botox, because the patient metabolism is fast, or the patient exercise daily, or their daily activities. For example, they have a dance school and then they teach dance classes the whole day. They're exercising and they're moving their muscles the whole day, so they metabolize Botox faster. So even though Xeomin or any Botox is FDA approved for 3 months, their Botox is not gonna last as long as 3 months. It's gonna metabolize faster, and it's gonna be a month or 2 months. Same thing for if we add more units. Sometimes adding more units relaxes the muscle, that it lasts a little bit longer. However, it creates also that frozen look that we don't want. So instead of telling the patient don't exercise, continue with your routine, exercise, we'd rather do it a little bit more often than doing a lot where we're still gonna metabolize it faster. There are different Botox approved. For example, Daxi is FDA approved for 6 months. How I've seen it is that it lasts longer, but it also correlates to the patient. The patient's metabolism. There are some patients that metabolize Botox faster. So if general Xeomin or general Botox treatment lasts on them 2 months and you have to do it again, then Daxi is gonna last double the amount of that. So 6 months. In general, FDA approved, Botox, Jeuveau, Xeomin. This sport is FDA approved for 3 months, and the only one that is approved for 6 months is Daxi. It should last around that amount. Sometimes it's less, sometimes it's more. Anything that we can do to make the Botox last longer is 2 things. One, we want it to be consistent. So because the Botox is FDA approved for 3 months, you want it to wait for those 3 months, see that the movement comes back, and then get again another Botox treatment. You don't want to wait until the wrinkles are completely back, because then we're going to start from zero and we have to add and then do the treatment again. But as you are consistent, you're gonna see that the muscle kind of like forgets how to contract in those areas, and it's gonna last a little bit longer. Because the idea is not to freeze or paralyze the muscle completely, it's just to relax enough so the skin can grow smooth, and then we can do it either less units or we can do it less often. And then the second thing to make Xeomin last a little longer is to maintain your skin. So once the muscle is relaxed, we have to work on the skin. The skin regenerates, and if the muscle contracts and creates the wrinkle, the skin is also gonna grow like that. So we have the Botox treatment, we have the Xeomin treatment, relaxes the muscle. Any treatment that we can do on the skin is going to improve, and it's going to help us get the treatment less often. We can do that with facials, we can do that with like little chemical peels, microdermabrasion, just like maintain the skin at home with your cosmetic products, just so the skin regenerates nice. So Botox is a treatment that it's done in the muscle. How it works is that it relaxes the muscle. Because it needs to be absorbed in the muscle, it needs a few days to see results. So when you're getting your Botox treatment, you're gonna have little pricks everywhere, but at the same time, you're not gonna see results. The results are gonna come up like probably 7-10 days later. Some patients said that they can see results in 3 days. Some patients said they can see results in 3 weeks. The most important is the Botox and the Xeomin gets absorbed in the muscle, and it relaxes the muscle, and that takes time. That takes probably 7 to 14 days. And the goal is that the muscle relaxes, so then the skin also relaxes and gets smoother, and that's how we treat the wrinkles. I've seen patients that the Botox lasts longer, more because their tendency to metabolize Botox is actually slower. They're patients that probably they don't need that many units, they don't need that often, because with time, as you are consistent and you have your Botox treatment, the muscle forgets how to contract, relaxes the muscle, and at the same time, you don't need it as often. There are some patients that actually they work out, they need a lot more Botox, or that they need to do it more often because the muscles are stronger. In general, men need more Botox than women, but there are some women that they need just a lot more or more often. So when we're treating Botox male versus female, it depends on the look that we're going for. But in general, men, I don't know who created this stereotype that they look good with a little bit of wrinkles or a little bit of gray hair, but their approach is also very, very natural, where we only treat more preventative than just like correcting every single wrinkle. That's what it's important to maintain that natural look in men than in women. And at the same time, for example, the product that we use in Botox versus Xeomin versus Dysport is how we're gonna choose depending on female versus men and the look that we're going for. In short, all the Botox brands are FDA approved for a specific amount of time, and we go based on that. So Xeomin is FDA approved for 3 months, but still different patients, different results. So there's some patients that are gonna last longer, there's some patients that is gonna last shorter amount of time. So in general, Xeomin or any other Botox takes a few days to work, more because the Botox works in the muscle, it needs to be absorbed, and then the muscle gets relaxed. So most of the patients said that at least 3 days to start seeing results. Some other patients that it may take 3 weeks to see the full results. In average, it's like a week or 2 that you want to wait to see full results and how it settles. So another thing also, when we're treating different areas of the face, it depending on the look that we're going for. So for example, on the upper head, we wanted to relax the specific muscles to give a specific look. So we want to lift the eyebrow, we want to relax the frontalis, and then lift the eyebrow also different ways. Here we can use Xeomin, for example, for the lower face, and we don't want to relax the whole muscle. There is a muscle in your jawline, almost like a curtain, that it creates this band called platysma band. So we use Xeomin to relax specific areas just to create more contouring. So it shouldn't be that we're looking for any change of movement. It's more about the look. And that you can see results probably in like 5 days, but you're not going to get more and more results as the days pass by because we're not relaxing the whole muscle. Here you can start seeing results probably 3-5 days later, and then little by little, as the Botox gets absorbed, the muscle relaxes more and more, and then you can continue seeing more and more results for like probably 2 weeks until it completely settles. So in order for Botox to work, it depends on the patient. It depends on the muscle and the ability to relax the muscle. Sometimes patients said that they can see results right away, but actually that's the prick in the muscle that relaxes it. So it's almost like when you have a muscle spasm that you think that like it creates that cramping pain or like it creates that relaxation, but it's just the prick that relaxes the muscle. That's another thing also for like acupuncture. You get acupuncture because that needle goes directly to the muscle to relax the muscle, relaxes the muscle fiber, and you get that facelift look, but it's momentaneous because the muscle contracts back. Some people may ask, is there anything that I can do to have the Botox result faster? I have a trip, I have a date, I need the results right away. And there is anything that we can do to make it act fast. So the best way is just to plan the calendar. If you're having a wedding, do it as early as possible. Talk to your provider and let's plan ahead so you can get the results that you want. We want to talk and have a consultation and develop for that event, because it might be that for example, if we're planning for your wedding, we want to do the main treatment actually 6 months before your wedding, where we do the injectables, and as closer we are to your wedding, we only treat the skin. That way we have the most natural look, but at the same time your skin is glowing, your face it's like sharp, and we can have the better results. The first time patients, we wanted to see the amount of units that we're using, the areas that we're treating, and the results that we're getting. One, because we're going for a very natural look, and then two, because long term, this is gonna give us better results. Having that plan, we know that this time I'm gonna treat, for example, the crossfit. But next time, it might be that the crossfit look good, but then the lines in the forehead are getting actually deeper. So it's always to have the consultation, look at the whole face, and at the same time, plan ahead or plan for what we're gonna do in the next treatment, or what are we gonna do in that specific day. It's always better to see the face and then develop the plan. So in conclusion, Xeomin and Botox takes a little bit of time to work. And that's why it's super important that you plan. You plan before a wedding, and then it's gonna be 6 months before. You plan before your event, and then it's gonna be 2 weeks before that event. So it all depends on what are you having, and then plan, because Xeomin doesn't take as fast to work and see results. In general, there is some practice that charge Xeomin or any Botox by the area, or they can do it by unit. What's the difference? In reality, there's not much difference because it's up to the provider. You want it to be evaluated for what are we gonna do, and then at the same time, just depending on the area, we can do a specific amount, or depending on the results that we get, like natural look, that we only treat just a little bit. So in terms of cost, you always want to talk to your provider and see, what am I getting for this price? Or is it the results that you wanted? Is the whole face being evaluated in order to get the look that you want? And then discuss cost. You can always talk to us and then see what's the best that we can do for you, not in terms of cost, but in terms of the amount that we're going to use in your face, or is it necessary to add a little bit on your jawline? Is it necessary to do a little bit of your bunny ears? Something that sometimes you may not know that Xeomin can treat, but at the same time, just by evaluating your face, we can mention and we can solve that problem with a little bit of Botox. Getting the most expensive option is never the right answer. The best is to get the most out of you in terms of your face and the look. Sometimes it might be that you need more Botox than fillers, for example. And then it's better to just do the Botox because that is what it's going to change and give you the best results. Or sometimes it's better just to do a little bit more filler and very little Botox, because the filler is the one that is going to change and then lift your face, and it's going to give you better results. So always evaluate the face, ask the provider what are the results I'm going to get, and that's when you pretty much make your budget from. Something that is super important about pricing is that it's not that we're recommending to go to either like the most expensive or like to the most cheap. The most important is that where you're going, the credentials that they have, the certification that the practice have, more because that is going to be a backup of the quality of the products that they use. There are some areas that they just dilute the Botox and they just do everything for like cheaper price because they are diluting it. And at the same time, there are places that they just charge you because they just want to charge. My belief is more about where are you going and who's doing the treatment. That's the most important. The most important is to have a consult, because from there we know, one, the amount of units that we're going to use, two, the areas that we need to treat. And depends on that, we can develop a plan, because it might